Most people think a medical emergency is obvious. Someone collapses. There's blood, sirens, panic. But many of the most dangerous emergencies don't look dramatic at all. They begin quietly. A little chest discomfort, sudden confusion, trouble breathing that seems mild at first, a headache that feels different than usual. And because the signs can seem subtle, people often hesitate. They wait to see if it passes. They search online. They tell themselves they're probably overreacting. That delay can be the most dangerous part. Because in many emergencies, the real issue isn't whether the symptom looks severe. It's whether the body is losing critical function. And you don't need medical training to recognize when that may be happening. You just need to know what patterns matter. Think about how people respond to unusual symptoms. If someone feels dizzy, they may assume they're dehydrated. If they feel chest pressure, they may blame stress. If a loved one becomes confused, they may think they're just tired. These explanations are reasonable. In fact, they're often correct. The problem is that serious conditions can begin with symptoms that seem ordinary. A heart attack may feel like indigestion. A stroke may look like clumsiness. Severe infection may begin with fatigue and chills. A dangerous allergic reaction may start with itching or throat tightness. The body rarely announces, "This is an emergency." Instead, it sends signals that something essential may be failing. Breathing, circulation, brain function. That's the framework that matters most. When you're trying to decide whether a situation is urgent, ask a simpler question. Is this affecting the person's ability to breathe, think clearly, or stay awake? If the answer is yes, the situation deserves immediate attention. Trouble breathing is one of the clearest warning signs. If someone is struggling to speak in full sentences, breathing rapidly, making gasping sounds, or their lips appear bluish, their oxygen supply may be compromised. Even if they remain conscious, that is not something to monitor casually. Changes in brain function are equally important. Sudden confusion, difficulty speaking, weakness on one side of the body, loss of coordination, or a severe unexplained headache can all indicate that the brain is under stress. These symptoms may come on suddenly, and they should never be ignored. Circulation problems can be harder to recognize, but the clues are often visible. Chest pressure, fainting, cold clammy skin, a racing heart, or unusual paleness may signal that blood flow is being disrupted. Again, the exact diagnosis matters less in the moment than recognizing that something fundamental may be wrong. The real issue isn't whether you know the diagnosis. It's whether the body is showing signs that a vital system is failing. That perspective removes much of the uncertainty. You don't need to determine whether someone is having a heart attack, stroke, or severe infection. You only need to notice that their breathing, thinking, or circulation has changed in a significant way. There are also situations where your instincts matter. If a person says, "Something feels very wrong," especially when the symptom is sudden and unusual, take that seriously. People often recognize when their condition feels different from anything they've experienced before. Pain that is intense, sudden, or unlike previous symptoms deserves particular attention. So do symptoms that escalate quickly. A mild issue that becomes noticeably worse over minutes or hours should not be dismissed. When in doubt, seeking urgent medical advice is usually safer than waiting for certainty. Many people hesitate because they don't want to overreact. They worry about wasting time or being embarrassed if it turns out to be nothing serious. But healthcare professionals would much rather evaluate a concerning symptom early than treat a more advanced emergency later. And that's the most important mindset shift. Medical emergencies are not defined by dramatic appearances. They're defined by threats to the body's essential functions: breathing, brain function, circulation. When one of those systems begins to fail, acting quickly matters more than having the perfect explanation. If you'd like a structured breakdown of the warning signs that should never be ignored, there's a practical guide linked in the description. And if you value educational videos that help you make better decisions in uncertain situations, consider subscribing. Sometimes recognizing the pattern is what makes all the difference.